Hey, Dr. Sports.
Hey, Dr. Payne. What's up?
I just got a complicated back pain patient that I really wanted to ask you some questions about.
Yeah, I don't really treat back pain, but shoot.
Well, how do you treat a musculoskeletal patient that has pain in multiple areas?
Unless it's a new trauma, they all have pain in multiple places.
They do?
Sure, pain causes weakness and compensation. So if someone gets a musculoskeletal injury, I can guarantee you that they compensate and get weak somewhere else. They walk different, they move different. Then we have to figure out how to get everything better so we can get them to rehab where they can fix the weakness and the compensation.
You send them to rehab after treatment?
Of course. It's the only way to get someone better. It's really hard to go through rehab when you hurt, and then after we treat them, if we don't put them through rehab, their pain will come back. What do you guys do?
Well, on the facet joints, we usually do diagnostic injections, and those last for about 4 hours.
Wait, you use steroids that only work 4 hours?
No. We don't use steroids in facet injections. If we did, then they wouldn't be diagnostic.
How do you figure? We do lidocaine and steroids in all our joints, and we consider them all to be diagnostic.
Well, we use steroids in all the joints except facet joints. Studies have just shown that it's not any more effective than just lidocaine.
How is it possible that the facet joint is the only joint in the body that lidocaine and steroid have the same effect on inflammation?
Well, they did do studies that show improvement in the short term, but by 3 to 6 months later, the steroids did the same thing as the lidocaine.
3 to 6 months? Who expects a steroid to work for 3 to 6 months? When we do steroid injections, we expect 8 to 12 weeks, and that 8 to 12 weeks is usually enough time for us to get through rehab.
See, we figured out that if you just burn the nerves to the facet joints, you can get at least 6 months of pain relief.
Wait, you burn the nerves first line?
Well, yeah, of course, it lasts longer.
To get through rehab?
No. We don't usually do rehab. We just send them home back to normal living and then burn the nerves again every 6 months to 2 years.
Does that affect anything besides the facet joint?
Yeah, it does shut down the multifidus for about 3 years.
But the multifidus is one of the major stabilizers of the spine. And through stretch receptors, that muscle tells the brain where the pelvis is in space.
Well, yeah, we figured that out. And that's why we have a spinal cord stimulator that can reactivate the multifidus.
So instead of treating the joint and then rehabbing while they're not hurting, you burn the nerves. And it lasts for 6 months, but you shut down a muscle that takes 3 years to come back, an important muscle. So you put in a spinal cord stimulator that helps activate that. How long does a spinal cord stimulator work for?
Spinal cord stimulators usually work for about 1 or 2 years before they burn out the spinal cord.
So when do you fix their gait, posture, stability, and breathing?
No, we don't do that. We just keep on doing procedures until the only thing that works is medication, and then we move them to permanent disability.
That sounds terrible. Imagine if I just burned the nerves to every joint that I treat. You guys only do this on old people, right?
No, we'll even do it on teenagers if they have back pain.
I think I'm getting a headache. What was your original question?
How do you treat someone that has pain in multiple areas?
Well, you have to clearly define the areas that hurt on physical exam, and then you have to figure out whether all the areas are related to each other.
But how do you know which one is the actual cause?
Who cares which one caused it to start hurting? They're all hurting. What you got to do is you go through your physical exam, you find out all the ones that are hurting, you treat them all so that you can get through rehab.
Well, in pain management, we just don't feel that the physical exam is helpful.
I think I'm going to be sick.